Hello guys, welcome back. Today we'll be talking about a salient but dangerous topic, the venous thrombosis. Stay tuned as I break it down in simple terms. What is deep venous thrombosis? As the name implies, DVT, which means that there is blood clots in the deep veins, especially the legs. We call it lower limbs. What are the risk factors for somebody having deep venous thrombosis? The risk factors are: one, obesity. Pregnancy is a risk factor. Smoking, for people that smoke, is a risk factor. If you travel a long distance, yeah, it is December period. A lot of people will have to travel around the country from one country to another, from within interstate. Long distance traveling can also predispose to having a deep venous thrombosis. Then the last one is long stay in bed. A bedridden patient can also have deep venous thrombosis, and that's why in the hospital you see them wearing a socks for them, so that to prevent deep venous thrombosis. Apart from that, there are some other things they do in the hospital, but we'll come back to that when we talk about the treatment. So, what are the signs or the signs and symptoms of deep venous thrombosis? So, if you notice that your leg is swollen, is painful, and you notice some redness or warmth, usually in one side of your leg, these are signs of deep venous thrombosis. Now, after a long distance travel, you suddenly notice that the back of your leg is paining you. Then you notice that there's a small swelling or a swelling in the leg, and it's reddish with some little worm. Please do not massage. Let me repeat that. Do not massage. This is not the time that, okay, maybe something bites me. Let me quickly massage. Do not massage. Quickly go to hospital because you might be playing with deep venous thrombosis. What are the complications that might arise from deep venous thrombosis? Especially when you massage. When you massage or you overlook this pain, maybe thinking maybe it's not something serious, and you are now walking, you are walking around. So this blood clots can dislodge, it can break away from the veins in the leg and goes to the lungs and block the lungs. So we call this pulmonary embolism. And when it clots the vessels of the lungs, what does it do? Because there's a blockage in the veins that supplies the lung doesn't get enough oxygen, so the person will not be able to breathe well. You'll have chest pain, the chest will be tightening, difficulty in breathing, and then in severe case, it might lead to death if nothing is done urgently. How do you prevent deep venous thrombosis? If you're going to do a long distance traveling, you might need to stretch your leg, walk around. By doing this, it can prevent uh, you having deep venous thrombosis. You need to active exercise is also helpful in preventing deep venous thrombosis. Those are the ways you can prevent deep venous thrombosis. Treatment: if you notice any swelling, pain, quickly go to the hospital to see a doctor. Adequate treatment, then you will be treated accordingly. I hope I've been able to educate you on what is called deep venous thrombosis. If you have learned anything on this video, kindly like, subscribe, and share to your colleague to save more lives. Thank you, and God bless.